So if you've hurt your lower back, he was a New Zealand physiotherapist, and he kind of figured out that if you do have a disc bulge, one of the ways that you can actually make it feel better is by really gently going into what they call extension. Please make sure you talk to your doctor. Go to see your primary healthcare. Make sure you're diagnosed correctly. Make sure it's safe for you. This is more just for fun and education. But essentially, the idea is that they imagine that the disc that's come out is like a little bit of a jam donut, and the jelly's come out and it's irritating on the nerve. And what this does is it kind of like makes a reverse suction, and it tries to suck the jam back in. So if this is the right one for you, and once again you've seen your healthcare professional and all that stuff, what they find is that just something as simple as standing and just gently coming backwards like this, and you think about it like a rusty gate, you're not trying to go because that can you might go too far too fast, and you might stimulate a little bit of an inflammatory reaction and make yourself feel a bit worse. So it's the repetition that gets you to feel better. So by just coming back nice and gently, by the time you get to about the 10th, you start to feel like you can go a little bit further and you don't feel as stiff. So if you're waking up in the mornings, you feel kind of hunched over, you're really stiff through there, just something as simple as this and giving yourself the time to start to move better can be really, really helpful. So that's just a great, easy, particularly if, once again, you've seen your healthcare practitioner, safe way that you can stand up at work, walk around for a little bit, get a little bit of blood flow through there, and then hopefully start to feel better. So we've got standing McKenzie's. Then we've got dead bug. Now, I've already done dead bug before, we're going to do it again.
Oh.
Not here though.
Oh, okay. Yeah.
So if you've hurt your back, one of the things that can happen is essentially like people always talk about your core shuts down, and what that means is the little muscles that are meant to hold the spine together and keep it stable, these ones deep through here, they're not firing as well as we'd like them to do. Plus your abs that are meant to kind of like work like a belt aren't quite coming on. So there's a simple exercise called a dead bug. It's called a dead bug because you look like a dead bug, that can help them start to activate. So if you go back a little bit, Christine, the idea is I'm like this. So if I have hurt my back, I'm in a nice neutral spine. I'm not hurting it. Obviously, if it is sore, stop, because you're meant to feel better. If you feel worse after, either you're not quite doing it right or it's not quite the wrong one for you, please check with your healthcare practitioner. But essentially, I push my spine towards the ground, just gently. And by doing that, it makes my abs start to fire. Plus, it makes those little muscles start to work. And then what we're trying to do, sometimes it helps to put your hand on it, is just to very slowly lift that leg up while keeping your spine in that nice neutral position. So if your core isn't active, what will happen is you'll lift your leg and your spine will come up like that. And what that means is if you do have any soreness or inflammation, it's just kind of like jolting it a little bit. So you're retraining those muscles to work, so that when you're walking around or moving, they're kind of keeping you nice and strong. So you push down, feel that there, and then you really slowly lift that leg up, really focusing on your spine not moving, and then you're going to move to the other. Now when you transition, that's typically when people go like that. So you want to really slow it down, making sure that your spine doesn't move and your abs are working. At some point you're going to have to breathe. And this is really good because if I have to relax to breathe, that means that every time that I have to breathe when I'm walking around, I'm not having those muscles be able to help stabilize my spine. So you're moving and then you're slowly breathing in, but while making sure that your abs are still on and you're protecting your spine really slowly. Once you get more advanced, that's when it turns into the dead bug. So see, if I lift both my legs up, if I don't keep my core active, it comes up like this. So it makes that weight harder. And then I'm adding my arms up like this. So it's making your body kind of have this nice muscle activation and stabilization down the whole spine. And you're just gonna do the same thing. So I'm making sure that I breathe, and it's a slow movement. We're trying to focus on this not moving. You can do it fast, in which case like your spine moves, but if you're trying to help develop stability through the spine, nice and slowly, And you can do it in any variation that you really like, but nice and slowly, making sure that you can keep that spine stable and you can talk and breathe and get that better. So in the morning when you wake up, you can do this before you even get out of bed. It'll help those muscles wake up and fire, so that when you do start walking around, it's helping hold your spine together, helping reduce your pain. The other thing that happens is, if these muscles aren't firing properly, your hip flexors and your glutes will go really tight to try and protect your spine. So by doing this before you do any stretching through that area, those muscles will naturally start to relax and you can feel better straight away.